GVN plays a very important role in terms of bringing together expertise in virology, in surveillance, in informatics, around viral threats to human health. And it does that through a network of centers of excellence, more than 90 of those across 40 countries. So it's very uniquely positioned to gather data that's needed to identify new threats to human beings and ensure that we are better prepared for pandemics.
It was an idea I had from coming out of the HIV pandemic, or not coming out of it, rather right in it, and recognized that in terms of the really basic virology and having expertise on a given type of virus, this was on the decline.
Having these collaborations and partnerships across 40 countries enables us to be always generating evidence in real time and to mitigate the potential impact it could have on humanity.
We need to merge the efforts of all scientists all over the world to fight against infectious disease, because if you think about it, all the major progress in medicine, they all stemmed from research, and this is how now you can save lives. There is no viral infection which would be specific to one country or the other. So the idea has been that we have national agencies such as the NIH, the CDC, which are very important for organizing the research. But we need to have networks which are working in a very flexible way, with only merge based on science, based on medicine, based on public health, which share their thoughts, their projects to really fight against this infectious disease.
A big part of also the need is collaboration. WHO and CDC and other organizations in other countries, they certainly have done a job, right? But in terms of the basic science, let's say, they could use help. They are still the commanders-in-chief, but we feel that the GVN fills a gap in having sufficient science that they could take advantage of.
This is major. It provides visibility to USF, it provides sustainability to GVN, and also USF has a lot of international activities which are extremely useful.
By having a critical mass of scientists with the knowledge and expertise from different disciplines, you're able to then simultaneously set up diagnostics and start looking at therapeutics or discovery research, the innovation that goes with each of those, and then having the clinicians with the expertise and having the clinical infrastructure to move things along. And that's what the centers of excellence and the network of centers do, is it enables all of that to happen in an unprecedented way.
We can connect people, and we get early information because we have centers everywhere.
And we have some of the best minds in the world in terms of virology, and walk in the footsteps of these giants and have that opportunity is incredible for anyone in the world. So that the emerging virologists, the emerging clinicians are learning from the best and building on that to ensure that future generations are better prepared.
We listen and learn and see where we can fill in more. But mainly we want to train. So we want their young people to be part of the GVN. And what I recommend to young people, you got to be willing to be wrong and be foolish. Do the science that's current in the field, try to get grants that way, but keep a pocket on the side where you stuff into it your crazy ideas.